Hello, dear viewers. With your permission, I would like to introduce you to the results of our work on the topic assessment of the functioning of the sympathoadrenal system in an organized population prone to stress. Cardiovascular disease account for 50% of non-communicable disease in the global population. In particular, hypertension remains one of the most widespread and major problems worldwide, including in Uzbekistan. According to the American Heart Association, by 2030, the number of deaths due to cardiovascular disease is expected to reach 23.6 million. Despite the therapeutic and preventive measures taken in Uzbekistan, the prevalence of cardiovascular disease is high, and the complications, disability, and mortality associated with them are still high. Taking into account the risk factors that cause this disease in the treatment and preventing the complications it causes are of great importance in improving the quality of life of patients. The diagram shows how tyrosine produces DOPA produces dopamine, then noradrenaline, and noradrenaline produces adrenaline. Them all chemical formation under the influence of MAO enzyme, a catalytic enzyme that decomposes adrenaline and noradrenaline. The purpose of the study is to assess the functioning of the sympathoadrenal system in employees prone to stress and automotors and introduce methods for preventing identified disorders. Research objectives: to identify stress-prone employees with automotors, to assess the activity of the sympathoadrenal system and the activity of the dementing enzyme monoamine oxidase among stress-prone employees of automotors corporation. 3. To determine the level of catecholamines in the circadian rhythm in a population of people prone to stress. Objects, materials, and general characteristics of the populations involved in the study. In order to achieve the goals and objectives set in our scientific work, the population of the automotor scientific in the city of Osaka, Andijan region, was taken as the objects of research. Research methods: standardized questionnaires to determine the quality of life, physiological status, anthropometric examinations, height, body weights, body mass index, ELISA method according to blood catecholamines, adrenaline, noradrenaline, dopamine, in the serum amount and catecholamines dimension activity of the enzyme monoamine oxidase, determination and in urine catecholamines daily and circadian in rhythm urine with excretion to determine. ELISA method according to in urine the amount of vanillamidal acid to determine. Statistical analysis. Our research consisted of 3 stages. In the first stage, a screening questionnaire was conducted to determine the psychological state of employees and their level of susceptible to stress. In the second stage, clinical and laboratory examinations were conducted on selected employees. At the same time, their working and living conditions were studied. In the third stage, preventive measures and treatment were carried out on the examinations. According to the 10 rule, 174 employees were separated from the total of 44 employees working in transport and office of Uzavta Motors company, and they were divided into 4 groups and subjected to in-depth investigations. Analysis of clinical characteristics and risk factors of the examined groups showed that according to the results of the Minnesota questionnaire among 1174 employees, anxiety of in-office workers was 25%, sexual dysfunctions was 30%, attention deficit disorder was 32%, and depression was 90%. In turn, these indicators increased to 52% in long-distance workers in the transport department, and sexual dysfunction 37%, attention deficit disorder 43%, and depression. During the study before treatment, the levels of excretion of catecholamines in the examined and control groups were statistically significant higher in blood than in the control group by 2.9 times. Noradrenaline increased by 3 times. Dopamine increased by 3.1 times, and in urine, adrenaline 2.3 times, noradrenaline 2.4 times, dopamine 2.5 times, and WMK increased by 41.1%. Circadian rhythm of blood pressure during ascent in long-distance drivers. The highest blood pressure values were determined. The highest peak was observed between 8 and 12 on the ascent, and adrenaline during the ascent was 2.3 times higher than in the control group and 26.3% lower than in the ascent. Noradrenaline also increased 2.6 times higher than in control group and 22.5% lower than in the ascent. Dopamine was also at a high level, 2.4 times higher than in the control group and 24.3% lower than in the ascent. This slide shows the amounts of catecholamines in the circadian rhythm. Urinary and serum catecholamine excretion parameters in the studied group after treatment with antioxidants. In group A, which underwent treatment with vitamin E and conventional therapy, urinary excretion of catecholamines was as follows: in group A after treatment are decreased by 1.2 times. Noradrenaline decreased by 1.8 times. Dopamine decreased by 1 times. And UMK decreased by 1.06 times. In group B, the following results were obtained after treatment. A decreased, adrenaline decreased by 1.5 times. Noradrenaline decreased by 2.5 times. And dopamine decreased by no statistical significations. WMK decreased by 1.1 times. Serum MAO enzyme activity levels in the studied groups after treatment. In group A, MAO activity increased by 60.1% after treatment. In group B, we observed a significant increase in serum MAO activity by 2 times compared to pre-treatment values and approaching the control group values. Thank you for attention.